All right, so hi there. Thank you for watching this. Since the onset of the pandemic, we've been seeing an increase in discussions about how certain groups are being disproportionately affected by COVID-19. And so today, I wanted to talk about the health disparities that we are seeing in the Native American communities. But before we get started, I want to introduce myself. My name is Nicklin Charlot, and I am an intern with the Research to Policy Collaboration. And today we are here with Dr. Anne Michelle Daniels, who is a professor at South Dakota State University. And Dr. Daniels, would you mind briefly telling us a little bit about your research area?
Yeah, I work a lot with the indigenous populations and trying to figure out how to bring research and evidence-based programs into the reservations and to make sure that it meets the needs of the Native American people.
Perfect. Thank you so much again for being here today. We're so happy to have you with us. And so to get started, can you tell us a little bit about the health disparities that we are currently seeing in Indigenous communities during this pandemic?
Yeah, we just like any other minority, we're seeing a lot of more COVID cases across the different tribes. One needs to understand that when we're talking about indigenous populations or Native Americans, there's 574 recognized tribes in the United States. So when we're talking about tribes, we're talking about a lot of different ones. And just to give you a little bit why this is important, when we're looking at, as of May, when we were looking at how many per 100,000 people, in the general population, we had 400 cases per 100,000 people. If you were looking at Native Americans, it's anywhere from 0 to 3,300 per 100,000. And the reason that's important is, one, there's such a disparity between 0 and 3,300, right? Part of that is we don't have good data, right? So right there's the disparity. And that's important for us to recognize, because if you don't have good data, it's hard to manage the actual disease and figure out what we need to do. We also have found that there tends to be more deaths as well, and part of that is lack of health care and chronic illness as a whole within this minority. One of the things that we need to know is that Native Americans overall lack the income that the rest of Americans do have. So we have lower income, which means there's lower resources. Right? And when we're talking resources, we're not just talking about, they're not just getting their PPEs, which is the personal protective equipment. They're not. Masks and gowns and medical equipment isn't getting to the tribes as fast as they should. So getting just individual masks and trying to get it. If you live in a rural area, again, I could use various sites to order my stuff in. They may not be able to do that. And a lot of the areas that are reservations, if you live on a reservation, it may be 60 to 100 miles to your local Walmart or to a place that would, a pharmacy that would actually have the protective gear that you need. And if you're already low on money, the gas money to get there, then we know that a lot of people have hiked up hand sanitizer. The cost of masks are high. So that's a double whammy for them, right? And then you're getting them off the reservation, which gets them around new people, which means they can actually be infected quicker, or, it could be a different set of people, which means there's a better chance maybe of getting COVID-19. But it's not just that. Right now, a lot of our indigenous populations still don't have running water, or they may not have good plumbing. They don't have Wi-Fi. We think everyone in America has Wi-Fi. Well, not a lot of them don't have Wi-Fi. There's also issues with electricity in some of the areas. So when you add a pandemic and you can't find out what's happening on the news because you don't have electricity, or you aren't getting your PPEs and your protective gear, or you don't have running water to be able to wash your hands, which is one of the biggest things the CDC says that we can do to protect ourselves, there's an issue there, right? So that's one of the reasons. The other is because low income and because of all the other reasons I just said, there is some chronic illness across the tribes within the nation, and some of that is diabetes. And what we know about diabetes and obesity within the COVID-19 issue is that's two of the top reasons that people die from COVID, right? They said that maybe over 10% more if you're diabetic. So that's important for us to recognize. Historical trauma is another thing. Now, historical trauma is what is happening with the Native Americans in the past that affects their future and now. It's a real thing, research-based, and basically what it says, it affects their physical and mental health. And so we have to watch historical trauma. And this is not the first pandemic that has happened to Native Americans over the years and since colonization time. And this is very important because it's wiped out a lot of tribes over. So they take this stuff very, very serious overall, okay? The other is, of course, the rural areas. You may, if you live out in a reservation, and you may not be able to get Instacart or Grubhub or Postmates to bring your food to you. So that just some of those logistics is very important for us to recognize. And then the culture itself. Isolation is not pretty typical with across Native American tribes. Now, I want to be very clear. You cannot say that all Native American tribes are the same. So when I say across, I'm giving you a generalization, but not every tribe is the same. They don't all follow the same rules. They don't have all the same spiritual beliefs. They don't have all the same language. And, of course, that defines the culture. So that's very important for us to recognize. But overall, it's very important to us to know that isolation is not a big thing that they're going to want to do because they don't follow the nuclear family a lot. Lots of times it's larger families living together. So you have grandmas and aunts and uncles and mom and dads and all your cousins all living in a small area together. So to be isolated or to think that I can't help my elder, which is a huge part of a lot of Native American tribes, they're going to have a hard time isolating. Healthcare is very poor in a lot of areas and with Native American tribes. Now, like I said, 70% of Native Americans may not live on a reservation, which means they may be in an urban area, but a lot of the money that goes to Indian Health Services, IHS, will go to some of the rural areas, trying to help with protection of child protection services or Indian Health Services itself as in medical care. So some of the urban people, Native Americans, may not be able to access IHS or get their testing through IHS because of that. Lack of testing is another one. Getting the tests out to them, and then for the tribes to be able to get the tests from the federal government can be an issue. Also, revenue is down and their tax base is down. Just like any other economic standpoint, they've been hit hard.
And then going back to the point about electricity, just to clarify, the lack of electricity, lack of access to things like Wi-Fi, internet, that means that there's less access to education about COVID, and so that can lead to...
Absolutely. Now, a lot of tribes are definitely using some of the money they got from the CARES Act. $8 billion was given to tribes. Now, $8 billion sounds like a lot of money, but when you have 574 tribes, and they already are strapped for money for health care, IHS, it's not a lot. But it is something, and I'm very happy to see that the CARES Act did do that. They spent a lot of money, some of that money on education, but that's more posters and maybe your health services, like your health department may have posters up, but as far as everyone having equal access to get the information, that's not going to be the case. But I want to be clear that a lot of what I'm talking about isn't necessarily just to Native Americans, but it affects Native Americans so profoundly that we need to speak of it.
Could you tell me a little bit about the disparities, if you know, the disparities we're seeing between, like, in the rural Indigenous communities versus the more urban Indigenous communities, if there's differences there, if all the stats just kind of get lumped together? Most of them get lumped together. That's the other problem. When we're talking about the lack of data, there's three things that's having some issues with data. One, data collection. Right now, the CDC
as of in May, was not sharing the data with the tribes. They had actually refused that. And the Public Health Emergency Preparedness, or PHEP, through the CDC, was not offered to the tribes. So that's an issue. The other thing that needs to be known is that not in every state with the Census Bureau, not every state has a line for Native Americans. Some have other. And so it gets lumped in with a lot of other, and so we don't have good data with that too. What we know about on how many that have been infected and how many that have recovered and how many have died, we do think is underrepresented because of some of those issues, because other isn't being counted. Because when you're in the urban area, you may not have someone come up and say, hey, oh, you're Native American, we're on the reservation. A lot of people automatically assume, or they're registered members that have lived there their whole life. The other thing with some urban issues is, like I said, a lot of the money from IHS doesn't always go to the urban hospitals. And so a Native American may not go to an Indian health hospital where they would on a reservation. So you're not going to have the data there as quickly. Now, they may have some other issues also. They may be low income as well. We know overall Native Americans have lower income than we do. Only 1% of the money goes to urban areas as far as IHS, 1%. And when you have 70% of the people off the reservation, that's a big deal, but you need that money to go to the reservations because they have very little.
A really good job of outlining what the disparities are and a lot of the reasons that we're seeing for them. And so now I want to kind of dive into what can we do? What are some of the solutions to these problems, both for urban and rural individuals as well as across different tribes? Because obviously, like you mentioned before, there's a lot of nuance. So how do we tackle those issues and not lump everyone together and make sure that everybody's kind of getting what they're needing?
Very number one thing is ask the tribal governments. Because these are sovereign nations, they have tribal government chiefs. And so you need to be able to ask and say, what do you need and how can we get it to you in the best effort, right? Lots of times we tend to make decisions for people and then not understand the culture. So we need to ask. And then we need to make sure that we give it to the actual tribal government and don't give it to like a for-profit. It would be good to go to the nonprofit if we could. And one of the reasons why is if you give it to the tribal government, then they can disperse it in the way that they disperse most things, which is usually pretty fairly. The for-profit can eat up a lot of the money before it gets to the people. We need more data. And it needs to be a shared responsibility, which means it needs to be the CDC. It needs to be other hospitals working with tribal hospitals. So IHS needs to be working with the urban hospitals that may be non-IHS, because if a Native American goes there, it needs to be a shared responsibility because, again, if you can measure something, we can usually know how to manage it better. But we have to have good measurement, okay? Another good way that we could work is to make sure that we work with the tribal epidemiology centers, and there's several of them across the nation. So to make sure that non-Native epidemiology centers are saying, hey, here's our best practices. Here's what we know that works. Let's share them with you. Let's try to use some of the same practices across the board so our data makes sense, right? So you're not comparing apples to oranges, right? Then we need to make sure that we are getting the PPEs, and if we could, to get the resources to the people as fast as you can. So if we could find a way to streamline it and to work with the tribes to make sure it gets streamlined, that would be helpful. So to overall look at what can we do now to make sure we educate so we don't infect more, and that we learn about social distancing, and that we help them set up ways to do that, and that we could work together and show best practices that non-natives are doing with natives. But then also is to continue to help with historical trauma, to continue to help educate and bring the people up a little bit. Now, one thing that we need to understand, these people are still incredible, beautiful people to learn from, and they all have something to teach us. So not only should we ask and say, here's what we're doing, but we should teach them, but we should take the time to listen and learn what they're doing too, because they have a lot to teach us that we could take back to the non-Native people. And then to understand that IHS, Indian Health Services, is dramatically underfunded and understaffed across the board. So if there was a way that we could come together and say, how can we help IHS? And help staff them and bring people in to work with them and to bring more money into them.
And going back a little bit to the historical inequities that we're seeing in Native Americans, what are some of these historical inequities that are leading to the disparities, and then how can we help to address them?
So getting more and more educated, and we know with higher education you get higher paying jobs gets you out of poverty, right? So that's one thing. Two, make sure that we do have good education about health and what that is and what health and well-being can be, and understand proper nutrition. Diabetes is something that's pretty high in the Native American across the tribes. So to be able to have good diabetic education and to make sure that they have adequate health care for that, and adequate health care on getting the insulin they need and the supplies that they need. And then third also is to be able to make sure that there is good child care and child care protection across the tribes. Lots of time when we're talking about quality child care, parents, especially parents of lower income, instead of looking at quality, they look at two things that's important, and that's accessibility and affordability. Can I afford it, and is it accessible around me? And what we're finding is it's not always accessible in rural areas or even urban areas that would meet the needs of the culture. And then it's not affordable.
And so I'm wondering, for those connections between tribal health services and non-tribal health services, what are some ways on like a policy level that we can better integrate those two things? Because right now it sounds like there's a bit of a disconnect going on there, and I'm wondering if we know why that is, how that might be fixed.
Yeah, there's lots of programs that they're exploring and some have started doing. And the rural areas have done this for years, whether tribal or non-tribal. They need to get someone to come to their local hospital in a rural area, and so they'll say, hey, we'll pay your tuition to medical school, but you had to come back and give us 5 years at the hospital, or, something to that effect. More and more people are being able to do that to get Native Americans to go to professional fields. They'll say, we'll help pay your tuition, but then you come back to the reservation and you work on the reservation for a while. And then hopefully they'll mentor more young people that want to go to school, and they'll see more people saying, oh, I see my friend Raven over there that is this beautiful, beautiful mentor of mine who's Native American, and I'm a Native American young girl. I want to be like her, so I want to go. The other thing I think is important, and something that I think could be easily done, is to have a internship and volunteer program that allows people to come in to the reservations and working with Native Americans to say, how can I help?
But because there's all that nuance, I'm wondering what really needs to happen, I guess, more at the federal level then, because I'm seeing it like more local, tribal levels. You really need that nuance. But at the federal level, what can be done, like helping those individual communities?
I think three things. One is to recognize the federal government needs to recognize the need for grassroots, for them to give money to for grants for planning years. In order to work to go in and work with reservations, it takes time and it takes effort. It isn't something you go in and you can have a 1-year grant and get anything done, because building relationships is one of the number one things. So for federal government to be able to write programs, whether it's for monies for grants or for federal programs that don't say this is going to be a 2-year program, but understand it should be 3 to 5 year programs just to get it up and running and to be sustainable. 2 is to have more of our congressmen and women and our representatives to be Native American, to us to have more people within tribal, that have true tribal understanding to be able to represent all of us, because they have something to offer all of us, whether you're Native or non-Native. And then 3, I think, to be able to open up more of a conversation with tribal governments, where it's not a us against them, but it's a we. And so to have that attitude that when you're working with the tribes, you're not just helping that tribe, you're helping the nation as a whole.
Going back a little bit to infrastructure, I know you talked about some tribes lacking things like electricity, water, really key things. And so I'm wondering what you think are good ways of kind of overcoming those barriers to having access to information, and then literally like being able to perform healthy practices like washing your hands. What are ways that we can help these different communities get access to those needs?
I think there's 2 things that's important. Is one, again, the agreement between the tribal communities and our local, state, and federal governments. So our treaties have to be recognized, and the treaties have to be actually met and done. Is to really look and say, how are we meeting this with the trees? Are we making sure that we're doing what we're saying with the water? Are we making sure that we're treating the land like we said? To revisit some of that and to see, well, if we tweak this a little bit, is this going to increase their ability to have A, B, and C? And if so, again, if we do this, it isn't just helping the Native Americans, it's helping the collective we, right? And to go back to that idea. This is not a little problem. COVID just amplified issues that are already there. And that's what's even more scary. And that's why when you ask a question of, well, what can we do? You have to go back to, that's why I said go back to that infrastructure, look at what we can be doing overall for everyone, because it has to be done to be able to help with COVID as well.
Yeah, like this is definitely this is a big picture problem that's affecting everybody. And the way to solve it is we have to solve it for everybody, not just in different pockets or communities.
Right.
Although, just to kind of to take things a bit of a step back, though, are there any problems, any disparities because of COVID-19 that you think really are very unique to the Native American community?
2 things. One, I think you go back to the health disparity itself. I think is very different and maybe more amplified because Native Americans are truly the only people that's been promised free and appropriate medical health care in the United States, right? So that's part of it. I think the second thing that's important is the historical trauma, the fact that they've seen what it has done to their tribes and their collective unit over the past 300 or 400 years, what some of these pandemics and these diseases has done. And then the historical trauma has also caused some distrust with new people coming in to the reservations and to the tribes. That distrust can definitely cause issues when we're people trying to come in and help.
All right. Well, we've covered a lot of ground. Again, thank you so much for all of this. Is there anything else that you want to add, either about the disparities or the solutions to those disparities? Anything we haven't covered yet?
The main thing is everything that we talked about, I think we could do. And I think it could be something that has a nation that won't just help our tribes, but will help our whole nation and heal us as a whole. And I think that's a beautiful thing.
Yeah, really, really well put. Again, thank you so much for being here. I really appreciate it.
You're welcome. Thank you for having me.